we're feeling cold. Ammari's laughing her usual, and she dressed like a stripper today, so don't mind that.
I'm Jamie.
I'm Ammari.
And
we're just two trying to make it.
Gosh, I've missed you. It's been a couple weeks.
Welcome home. Back to the cold.
Yes, I know. Gosh, right.
We are here at ARYA Med Spa. Demystify all of the treatments here.
Excited.
Hi,
Hello.
Hi.
Welcome to ARYA.
Welcome in, girls.
Yes.
Hi.
Yes.
It is gorgeous in here.
Oh, thank you. We love it. It's super bougie, but it's like it fits our luxury vibe.
Yes.
We love it. We're so blessed.
It's cold outside, but we're feeling warm in here.
Yes, exactly.
And this building, we actually have only been in this building about a year, so it's brand new.
Okay, so new.
Yes.
Wonderful, wonderful, wonderful. Well, we are here to learn about all the treatments that ARYA has to offer, as well as take a beautiful tour of the facility.
Yes. So this is our lobby. This is where we'll greet you. You
Yeah.
can come in, grab a cup of coffee, grab a water, and just chill. And then we'll bring you back to whatever service that you're getting done.
Okay.
Please show us around. I'm so excited.
Yeah, of course.
So we'll come this way. And first, we're going to be heading into our injection rooms.
Ooh.
So these three rooms in this hallway are all injection rooms. So the nurse practitioners and nurses work out of these rooms and treat patients with injectables. So Dysport, Botox, Daxify, those are the three
what's your
neuromodulators. Oh gosh.
I've done Daxify, and I love Daxify. I did that, but then I did just the regular Botox the other day, and I don't know.
Yeah.
I felt like I don't know that I'm as big a fan as I was of Daxify. Like, what's your?
So I think it really depends on the patient and what their goals are and what
My goal is no wrinkles.
Yes. So they're all going to be effective for that. But you know, they're all similar in that they have the same active medication, but they all have a little bit of a different protein molecule. So they respond a little bit differently in the muscle. So that can impact like longevity, onset, muscle movement in terms of like how flexible the treatment is. So I would say probably 80 to 90% of our patients in this office are treated with Dysport. So that is kind of like our go-to.
Yeah.
But I think they all have a place.
They have options for everybody.
Absolutely, yeah.
And you kind of like talk to your clients to figure out like what's best for them. Like, do you tell them all the pros and cons of all of it?
Absolutely. That's kind of, we offer complimentary consultation. So if a patient is new to treatment, that would be our first step to kind of figure out what are their goals, what's their budget, because they all are at a different price point.
Yeah.
So what's their budget? What are their goals? How quick do they want results? Because as you know, Daxify does kick in a little bit quicker.
Yeah.
So if they have a special event coming up that they're wanting to get treated for, that might be something we recommend
So
for them.
I didn't start anything until I was 37. Gonna be 38 next Monday.
Yeah.
And one of my girlfriends said, "Oh, we should have started so much sooner." Does it make a difference in your eyes? Like, do you need to start sooner? Like, what is the age that you're recommending clients to start?
So it's not necessarily an age, it's based off your anatomy. So if you're seeing those static lines or those lines that you see at rest, that's a good indication. Okay, maybe I should go see one of the nurse practitioners and get assessed. So those dynamic lines are those lines that we see when we make those movements.
Yeah.
That's what the Dysport, Botox, Daxify is going to act on. But what we are wanting to do is prevent those static lines from forming, because that's when we see those signs of aging.
Got it.
Yes, absolutely.
Yeah, so then there are other injectables that we offer as well. We do filler, of course.
And
then-
explain me the difference between. I've never done filler. Explain me the difference.
So with, like, as Audrey was saying, with Dysport or neuromodulators, Dysport, Botox, Daxify, you are working to relax the muscle to prevent that muscle contraction. So you're either softening those deeper static lines or just relaxing that dynamic movement to prevent those. With filler, we're really focusing on volume.
Okay.
So patients who maybe have some volume loss in the cheeks, or we also work to really like define areas. So maybe somebody wants a more defined jawline. So that's really the difference between filler. Filler is a hyaluronic acid base. So it's more of like a gel-like substance. So you are building structure or volume with that.
Okay.
So as we age, as we lose weight, we lose that facial fat. And that facial fat is what helps support everything, especially in this like preauricular area back here. When we have that support, everything's nice and lifted. And when we age, when we lose weight, when that fat pad thins, then everything starts to shift forward. So if we sometimes use filler to our advantage and place it strategically, we can get that lift still.
Yeah, my lips are going to crap.
You can also
So that's
hydrate.
that's
Seriously,
a primary
like,
area we place fillers.
I see that all the time. I'm like, oh, like these girls and their beautiful lips. I'm like, ooh.
I did notice that as well. When I lost some weight, I'm like, oh, you feel like your face is like just not as full.
Yeah, absolutely.
Yeah. So, all right, onward.
Yes. All right.
Where to next?
So we are headed straight down. We're gonna make a little right here.
Okay.
These three again are all just injection rooms.
Great.
And then we come to this room here, and it is our cryotherapy room. So this cryotherapy machine is similar to like if you've ever done an ice bath, but it's a lot more comfortable. So what it
Ammari,
does?
have you ever done an ice bath?
No, but I want to.
Yeah.
Who wants
Yeah. So this sends your body into a controlled fight or flight. So your body knows how to respond. It helps recovery, helps sleep, joint pain, muscle pain, inflammation, all
how long
those
are we
things.
staying in there?
Everything.
You can do it from a minute to 3 minutes.
Wow.
If you guys want to try it.
Okay, do you yes!
Yeah, you can get in there with your clothes on. We'll just
Yes,
have you
we're
put on
getting in there.
gloves and earmuffs.
Yeah. Okay.
What's the temperature in here?
So you can kind of place
Feels
it.
like negative 140.
So
with wind.
Hey, we love you guys. We're getting in here. We're gonna let you know
Yeah.
what it is.
And this is beginner. Intermediate. Do people actually do that? Someone does cryo pro?
Most of our patients are doing like beginner, intermediate. We haven't got like the cryo pro or cryo extreme yet.
Yeah.
When you do the cryo, is this something that you can do? That you want to do daily, weekly?
So your first time that you come to ARYA, your cryotherapy or your red bed session is always complimentary. And then you can kind of decide from there. We have patients who do a mix of both. We have patients who just love the cryo, patients who just love the red bed.
Yeah.
But then you can kind of come in based off your goals. So if you want to come in daily for athletes who are recovering, they can do that. If you're like, I can only make it in 3 times a week, then you can benefit from that as well. So it's kind of up to you. Yeah.
Okay, wonderful.
Who
Are
wants
you ready to
to
take a dip?
give it a go?
Can't we just do it together?
Oh,
I
you
mean,
can get it
good.
together. Just you don't want to like touch the walls, but you can definitely kind of squeeze in there together.
Yeah. And we'll start you out easy. We'll do like a minute. Does that sound good?
A minute!
It's for our health. It's for our beauty.
What the actual hell?
You got this, girl.
I love it.
Admittedly, I do not get in the cryo myself. I know it's cold.
She goes, you got this.
The benefits are
My husband's
Are
gonna watch this and be
amazing,
like,
though.
what did you drink before you did
You
this?
guys let us know if we're glowing really good when we get out.
All right.
Okay, what do we do?
So whenever you guys are ready, you can just walk right in.
Okay,
Do we need those things or no?
That's
oh
enough for you.
yes,
We'll have earmuffs.
gloves.
A mask and gloves.
Yeah.
You can keep your shoes on if you'd like.
Let's see. I think we have more in here.
Thank you.
too.
There you
I'll
go.
take all the help I can get.
I know. I don't know. Here, wait. I feel like if we do a mask, won't hear us talk.
Yeah, definitely need gloves.
Yes.
Gloves.
Here. I'll just.
I've got some gloves. and
There's
I'll take
some. This might be big,
earmuffs.
It's fine.
And your.
I got it.
Here,
It's
I-
enough.
Yeah. Oh, there you go.
Thank you. Okay.
Do you have there's just one glove in here, I think.
Oh my gosh. Here, this might be the other one.
Thank you. Okay, so
What is wrong with that one?
I think it's like an extra large. Oh, here, girl.
okay, thank you.
This is the man's. I don't know.
Okay, so we're going here. We're gonna feel better when we get out.
Yeah.
Yes.
1 minute.
Don't
All right.
touch the walls.
Don't touch the walls. Got it.
Oh, it's snowing in here. Okay, so right now we're feeling cold. Ammari's laughing per usual and she dressed like a stripper today. Don't mind that.
We are. It is snowing in here. Is that our breath?
Yeah, no,
They're at
it is
15
snow.
seconds.
Wild.
We can't touch the walls, so I'm assuming we'll get freezer burn.
I know. Honestly.
Yes, now we know how that poor meat feels when we throw it in our freezer.
Yeah.
Okay, so this is supposed to make us feel better. Are we feeling better?
Yes.
She's lying.
Yeah.
Okay. What else? We gotta talk ourselves through this, so we're gonna freeze to death.
How many minutes?
We have a whole minute. How many seconds?
It's only been 30.
We've done 30 seconds. Okay. So right now I feel like my throat is freezing closed.
Oh, my nose is cold. I swear to God,
You got
guys
this,
are
girl.
here.
You're freezing with the skirt
All right,
on.
10 more seconds.
Oh
8,
my God.
7, 6,
Oh my God.
5,
You guys, this is
4,
the craziest
3,
experience.
2, 1. You guys can
Oh my
come
God,
on out.
My nose is freezing. Oh, we gotta come out. Oh, thank God.
You did it. A minute.
First of all, her hair froze. She said my hair froze.
Do you
How are we
immediately feel
feeling?
more energized?
I'm awake. I am awake. That, yes.
Yes!
Been a cup of coffee
Wake
right
it
now.
up!
That is the craziest shit ever.
Yeah.
Yeah.
Yeah. Well, we're thankful I
Oh
experienced
my
that.
goodness. Yes. Yeah. You do not need coffee when you do that.
Have you guys ever done an ice bath?
No.
No.
Okay, so this is a lot less
You're
like
welcome, girl.
initial shock than an ice bath. And like the ice bath, it's almost painful when you initially get into it.
Yeah.
This will slowly warm your body up, but you get the same benefits. So a lot of people who have done both, they
what
prefer
do you
this.
just benefit from doing that?
Your
So-
release of endorphins.
Okay.
And so you're going to have a benefit for like an anti-inflammatory benefit.
Okay.
Most
Increased
people
energy.
increased energy, but a lot of athletes use it obviously for like muscle recovery.
Yeah.
So we do have some athletes, local athletes that come in and,
And
use
how
it
often
frequently.
are you recommending like just like how if I was gonna like go deep dive in this, how often would I do this? Once a week?
You could. Some people do it daily,
Huh.
but I think once or twice a week is a good starting point.
I'm feeling energized.
You are.
Yeah.
I mean, I just want you negative 140, negative 150. I just want to know that is. It feels like high wind. So like you turn it up and it feels like it's like blowing.
Yeah, like a blizzard almost.
Wow.
Yeah.
Why did it look like snow in there?
It's insanity. I think it's just because of the freezing cold temperatures.
Yeah. Oh my.
It was funny. Yeah, even your eyebrows got little snowflakes on them.
Yeah.
It was really cute.
Crazy,
Really cute. Okay.
crazy thing.
We're cooled
right.
down now. Let's
We're
warm
headed
up.
this way. And then in this room is where we perform the BBL Moxie laser.
Ooh.
So
Yeah,
this laser can do a variety of different things.
Okay.
So this guy is called your BBL.
Okay.
We have little different filters in here to target different wavelengths of the skin. So we have one for laser hair, one for vascularities and redness. If you struggle with rosacea, you can come in, get that done. Pigment, brown spots, signs of aging, all of that. So that's what this BBL portion is for.
Yes.
And so that really helps us get that even skin tone. And then we come over everything with a Moxie laser, which the beautiful thing about this laser is it's safe for all skin types,
That was gonna be
all
my
year
question.
round. Yes. And this is a light resurfacing laser, so it'll just take off that top layer of skin to make everything nice and smooth for us.
Oh wow.
Also texture, pore size. This will also help with any pigment that's lingering. So this is a great pre-rejuvenation laser. People in their 20s, 30s who aren't ready for a deep CO2 yet or anything crazy, start with this guy and it really eases your way into it.
Yeah. We like to call it like a skin polisher. It's like polishing the surface of that.
Nice. So, what's the recovery time on this? Like, do you experience the actual peel, of your resurfacing of your skin?
So with this BBL portion, the downtime is little to none. All of your brown spots are going to turn darker and then sort of flake off.
Okay.
But really with this guy, you may be a little bit swollen, but other than that, good to go. This Moxie, if you add that on top, they're beautiful lasers separate.
Yeah.
Together, they're amazing. That's what our perfect world, we would always pair them together. With the Moxie, that's going to be around 5 to 7 days of redness, have a little sandpaper-like rash.
Okay.
And then again, all your brown spots are going to kind of turn dark and then sort of flake off.
Okay, great. I always like to ask that because plan accordingly. You know,
Absolutely.
I got a peel one time and then I
You look like a
forgot.
crazy person.
Yeah, answered the Amazon door and the delivery driver was like, "Whoa!"
Oh, what's happening in here?
Yes.
So that's great, but easy peasy. You can go back to work the next day.
Go back to work the next day.
Awesome. I love it.
Yeah.
Good deal.
Yeah.
Onward.
Yes.
Okay. So we're actually going to go down to this next room here. So in this room, we, a lot of people might not realize that we also offer vaginal rejuvenation here at ARYA.
Okay, so explain that to me.
Yes.
Vaginal rejuvenation. Why do I need it? When do people like, yeah, I know I need it? Like,
Yes.
Recovery time, all of that.
Absolutely. So really there is no downtime.
Wow.
It's essentially a transvaginal laser. So if you think about like a transvaginal probe, like if you're having a baby, it's very similar. So it actually lasers the vaginal wall, the tissue of the vaginal wall, to help tighten that tissue.
Yeah.
So
and what are they experiencing when they come to you?
yeah, so a lot of women may come to us like if they've had children or experiencing a little bit of incontinence. You know, they're jumping on their trampoline with their kids and having some. If you have had kids, you have to understand. Yes. And so that's one of the main reasons we use the device.
Okay.
Or if they're having some vaginal dryness, it will also help with that.
Okay.
So those are probably the two main reasons that we use
And how
this
many
device.
times will they need to?
It's a session. It's a series of 3 sessions.
Okay. Okay.
Spaced about a month apart.
Okay. Wow, that's definitely.
Yeah, very minimal. We like to call it like a lunchtime procedure because it takes the treatment actually takes like 10 minutes.
And what is
very
the pain?
quick.
What is the pain level? for
Very minimal. Patients are very comfortable during
this? So if
the
I can
procedure.
get my vagina sugared, I can handle this.
100%. Absolutely, yes.
There you go.
Much more comfortable than that.
You want to know, right? Like,
Absolutely. Yes, if you've ever done like any kind of waxing, think about that and like
This will be a breeze.
it's gonna be a breeze for you.
Okay.
Yes,
There you
absolutely.
go, guys. You can do it.
Yeah.
Great.
I mean, seriously, like you gotta know. I mean, I wouldn't want to come in here and not have any idea of what I was getting myself into.
Do we need to talk about the face
Oh, the VISIA?
Yeah.
Do you want to talk about it?
Talk about it in the VISIA room.
Oh yeah, let's do that. We actually have a room dedicated to that
Got it.
service.
Got
Yeah.
it.
All right. And then
So
this
beautiful
room
here.
to your right
Okay.
is our cool sculpting room.
Okay.
So this will help with body contouring. Essentially what we're doing is freezing fat through this service. So Emily, one of our estheticians, performs this service. People come in for a few cycles. They might have to come in multiple times. And then they're around an hour to 3 hours based off of the procedure time and how large of a surface area it is. They come in here, they relax, they can watch Netflix while the procedure is going on.
Okay.
Again, patients are pretty comfortable.
Yeah.
This is a very easy.
Not very painful.
So the cool sculpting, you can target very specific areas? Is that what I'm hearing?
Yes. So this one will act on fat. We also have an end sculpt that will help on muscle and muscle tone, muscle growth. This will help more on fat. So especially under our arms and our stomach area, thighs. Those are pretty the most common.
So like you need like that cottage cheese look in my swimming suit. Like this would work for that.
Yeah.
Wow. Okay.
Yeah.
Great.
And a lot of people will treat multiple areas at one time. You can also do that. So you limit your, number of visits because you can treat
Yeah.
multiple areas at once.
I see.
Very cool.
Okay, great.
Yeah.
Okay, next up.
Okay. Oh, we can head down here actually, and we can kind of discuss our IV therapy that we offer here. So we have a nice little Zen IV therapy room.
Yes.
We do a variety of treatments from just simple IV fluids to probably our most popular is our Myers cocktail, which has a variety of vitamins and nutrients in it. Patients will come in, we'll get their IV started. They just relax in here for about 45 minutes is about how long it takes.
Okay.
And so yeah.
And what are they gaining from the Myers cocktail? Like why am I choosing to do that?
Yeah, so a lot of patients will come in, they're just feeling like fatigued, low energy, maybe a little under the weather, like maybe their sleep cycle's off. So there's lots of benefits. The Myers cocktail has magnesium, which is known to help with benefit for sleep.
Yeah.
And then it has vitamin B12 as well, which we also offer vitamin B12 injections. You don't have to do it in an IV form.
Yeah.
But that helps with
Energy.
brain fog,
Yeah.
energy,
Yes.
sleep. Again, it's also going to help kind of as a little bit of a metabolism booster if you're already like working with like diet and
Yes.
exercise. So yeah.
Just that
I
little
feel
bit
like-
of extra.
Yes. People love to come in before trips too.
Oh, absolutely. Travel is a
If they
huge-
know they're going to be dehydrated or not
Yeah.
consuming a lot of water, they'll come in before their trip to make sure that they're feeling
Good
the
to
best.
go.
Absolutely. Yeah.
That's wonderful.
It is a good idea.
Yeah.
And you can always add on, I know we're going to be talking about our esthetician services momentarily, but you can also add on an IV treatment while you're getting your facial.
Oh, nice. Oh, great.
Yep.
One-stop shop. I like it. Okay.
These are our esthetician rooms. So in here, the Esties will do custom facials, hydrafacials, and
I love a good
dermaplanes, anything
hydrofacial.
with the face and your skin. These are going to be your go-to girls. They'll develop you on a regimen and make sure
Yes.
that our skin is going to be nice and healthy.
I love a good hydrofacial. Maybe you could highlight some of the benefits of hydrofacial. Why is it better than a regular facial?
Yeah, so it will help clean out any of those clogged pores. So it's an FDA-approved device, which will help customize the routine for you and just get your skin barrier really nice and healthy.
It also allows like serums to just penetrate deeper into that tissue, which just your
Yes.
custom facial would not. So.
You are leaving glowy and moisturized.
Yep. And then the estheticians also offer, as does Audrey, microneedling, which is one of our highly recommended services
Yes.
here at ARYA. Recommended to everybody. And they also offer lash and brow services as well.
And why do you recommend microneedling to everyone?
Pretty much everyone under the sun can benefit from microneedling, regardless of your age, regardless of your skin type. Safe for all skin types, all year round again. But it's a very easy procedure. So it's an electric-based device. So you're getting those laser results without having all of that downtime, right? So you could do one, be good the next day. You might be a little bit red, might be a little bit dry, but other than that, you're pretty much safe to put on makeup within 24 hours. Safe to go about your day. So that's why a lot of people like it because the downtime is so minimal.
Yes.
You can target a variety of different things. You can target pigment, texture, skin tone, pore size, things like that.
Yeah. And microneedling, can we just do the face or can we target other areas?
Oh, yeah. You can move it down your neck. If you have any stretch marks, scars, you can do it over those. Some people do their stomach if they're having some laxity there.
Okay.
Nice.
Wonderful. Okay, lead the way. I'll follow you.
So again, these are just our esthetician rooms. We'll head this way and then we'll circle back.
Okay, great.
So we can talk about, we're actually going to go in here and talk about our red bed therapy. So again, just like cryo, it's lots of benefits. Kind of reminds you of like a tanning bed because it's full body.
Yeah.
So you basically come in, you kind of let us know what you're targeting in terms of like what are your concerns. So it could be inflammation, it could be sleep, it could be pain. And we can adjust our settings and timing to target that specific concern.
Okay, so what does it do for pain?
So it is going to help minimize, if you have a specific area you're having a lot of pain, so you're having a lot of pain in your back, your neck, the red bed has different wavelengths that have been studied and shown to target certain things, including pain.
I have not. I mean, some red light therapy just on my face.
Yes.
But
So similar
thing.
concept, except the wavelengths are going to be different because you're also going to get the skin benefit, 100%.
Yeah.
But this can target deeper at the cellular level to help, again, with inflammation, sleep, muscle recovery, like a lot of the same benefits of cryo, but in a different way.
is this a procedure that we can do, that we're doing daily, weekly?
You absolutely could do it daily.
Okay.
Again, depending upon what your primary concern is,
Yeah.
we would give you a recommendation on how often you would want to come see us.
Wonderful. Wow.
Yeah. But this, again, quick lunchtime, come in here, 10, 20
My
minutes.
son plays baseball, and we've had like 2 injuries back to back. I'm like,
Yeah.
you know,
yeah.
if this would be
Absolutely.
remember this. I don't
Yeah.
think he's gonna get hurt again, but you never know.
Yeah.
So
Boys will be boys.
We'll head actually down this way here.
Following you.
Okay, so obviously we know her.
Yes, that is me. This was right around a year ago. I think this picture was done in July. And then this was immediately after one of the lasers that takes place in this room.
Incredible.
Yes. So this Helix laser is a resurfacing laser. It's a deep CO2, but it can target a variety of different things. So I did it myself for acne scars. We have patients who are doing it for laxity, skin tightening. If you are just wanting
So
it
is that why you were drawn to what you do for a living? Were you like, you wanted to know more about your skin, or like what, like why, you know?
Yes.
Like,
Yeah. Over time, I've always just been empowered by beauty. Loved getting my hair. I've always been a girly girl. Loved getting my hair done. Loved getting my makeup done. And I just loved the feeling of helping someone as well. So this kind of combines both of the things that I love, anatomy and beauty, and then just helping people overall feel better. So if I can get somebody to a better result, and they leave feeling more empowered, more beautiful, that's just my passion and my why.
Oh, and I bet that like I love that I can see like you're here
and don't you feel like, because sometimes you feel self-conscious coming to places like these because you're like, yeah, these women have it all figured out. Obviously, they have all these things that can make them beautiful. You know, like you get nervous, but then seeing this, like, okay, she had struggles too. She's been there. She helped me get to a place where I feel better.
It makes it more relatable. Like, the only silver lining of going through this acne treatment is like, I don't know how to relate to the patients and be like, girl, I was there too. Let me hold your hand. We'll get through this. We'll figure this out.
Need that. It's like going to a spray tan when the girl looks like a supermodel. It's like, I'm not getting naked in front of her.
So with this CO2 laser, is it a little more spicy, a little deeper,
It's one of our more aggressive lasers, but it has different settings to it. So if patients are like, I don't want all that downtime, we'll change your settings and adjust your settings based off your goals. So if you want to do less downtime, you may need a few more treatments to get that end result, but we can still get you there adjusting the settings, if that makes sense.
I see. And is this safe for all skin tones?
We can target the laser to make it safe for all skin tones.
Okay.
We would just do different settings based off somebody's skin type.
Got it.
And then another procedure that takes place here is our Beautifill, and that is going to be our liposuction. Misty actually helps with that, so she can speak on that as well.
Yeah, so we provide laser-assisted liposuction. So it's your traditional, if you think about your traditional liposuction, it's obviously very similar, but it kind of goes like the extra step because it has a laser that actually helps to break up that fat to make the liposuction more effective. And then the laser also can help kind of tighten that tissue.
So when I leave, can I tell right away? Like if we did liposuction right now, I would know I got liposuction.
Absolutely, yes. It's immediate results. Yes. Yes.
You're going to come next time. I'm cooking immediately.
Yes. So we could do the abdomen. One of our primary areas that we do treat, and I think it is just an area of concern for a lot of women, is the like the submental area under the chin and that neck. So you can see this patient had beautiful results, and that was about a week post.
Wow. Wow.
Yeah, maybe 2 weeks. You do have some bruising, a little bit of bruising, of course, afterwards, but you can tell, like, just in a couple weeks, you feel very nicely.
And then okay, so she does this, how soon is she coming back to have you do it again? Like how?
You really should not need another treatment. We in our practice have never needed to treat a patient twice.
Wow.
A lot of that times that area is more of a genetic component rather than I'm overweight, I'm carrying my fat there.
So
it's more so genetic.
It's fixed.
Yeah.
Wow. So we got under the chin. What are some of the other areas that you guys will treat here in office?
So you can do the abdomen, the flanks, the like
Underarms.
bra line, the underarms, really like honestly most of the body. Yeah.
That is incredible. I'm mind blown.
It's physician assisted. So we fly Dr. A out from Florida, and she comes and she helps us with the procedures.
So she's a board certified plastic surgeon that we work with, who actually trained all of us in the device, and so we work closely with her. So we do cases several times a year with her, and It's really fun.
Are we
It's fun.
awake during the procedure? Like we're talking with you?
You are actually, but I will tell you, we just medicate you with a little combination of medications to help you relax, but you are awake. Though I will say that some people, especially for the submental area, it's very comfortable. We have had patients fall asleep during the procedure. So it is we keep you very comfortable.
Okay, great. And we need someone to drive us home. Correct?
Absolutely, yes. You do need a driver. We always want to make sure people get home, safely. Safety is our top priority. So yes, we'll have you. You'll have a driver. They can drop you off. You can do your procedure, and they can come back and pick you up. For the submental, you might be here a couple of hours. The procedure, but a lot of that is prep. Right, and recovery.
Yeah.
The procedure itself for this area might be 45 minutes.
Wow.
The abdomen, of course, that's a larger
Okay, so
area.
When their abdomen, are they able to like put pants? Like how much are they in pain after that?
There's a little bit of discomfort, but it's tolerable. Patients just usually take Tylenol afterwards, definitely tolerable. Nothing that you would need like stronger pain medications for.
Okay, great.
But you can really, you see results immediately.
Okay.
With best results seen at about 9 to 12 months, because you're going to just continue to improve with time as that inflammation goes down.
I see. Yeah. I cannot wait to hear more about this, like how to book, how to come in, get your consultations.
Yes,
and all that.
absolutely.
Sit down. Incredible.
And then we can go to what, the VISIA room?
Yeah. Okay.
Perfect.
We'll be right this way.
Hey.
So this is our VISIA room and our VISIA machine. What this machine captures is not only what we can see with our eyes and what's going on superficially, but also what's happening deep below the skin. So it gives us a good idea and a good rundown of what's going on. It gives you a set amount of numbers as to how much pigment we're seeing, how much redness we're seeing. So that can kind of help us develop a baseline. So after lasers, after microneedling, after facial services, we can see how your skin improved as well. So we as providers always look at it before and we say, okay, what else can we target in this service? How can we optimize these results? And this machine gives us a good baseline for that.
I love that because sometimes you are spending time, energy, and money, and you're like, is this working? And
Yes.
What do you feel like people's reaction is when they get their face scanned and maybe a couple weeks later you're seeing, yes, look, these sunspots are gone.
Oh, yes. Yes. So another great thing is, like I said, it gives you your number and it also gives you your skin age. So sometimes with patients are like, I'm not sure if I see a result or not. And we look back and we compare, okay, their skin age was a 39. Oh, well now it's a 27. So they're feeling more empowered as well. And they'll continue to usually see results 4 to 6 weeks after that laser.
Yeah.
Wow.
And this is a complimentary service that we offer here at ARYA. So when a patient is new to us, this is kind of our first step. So like we talked about the injectable consultation, this is kind of our first intro into the world of aesthetics,
And
right?
this is what you guys did at Casino Queen.
Yes.
You guys, a lot of people.
People loved it. Yeah.
Oh gosh, absolutely.
Yeah.
I think it's incredible.
Yeah. So another great thing is, like Misty said, we offer it complimentary your first time in and every time that you come after that. But it's a good way to get a baseline established as far as a skincare routine, because as we know, our skin, what goes on at home is going to be the most important. We can do all the things in the world here, but with collaborating with an esthetician to get you on a medical grade skincare regimen will give you amazing results and make all of your other things much more worth it and optimized.
And sunscreen, ladies.
Sunscreen, yes.
Put your sunscreen on.
So when you're doing a face scan, do you have to be barefaced?
Their best results are going to be barefaced. You can do it with a full face makeup on. It will read and pick up on certain things in your skin, but for that optimal results, we want to have you come barefaced. And we can always wash that up for you here. We can give you some makeup remover here. So if you're coming straight from work, you don't have to worry about that.
Yeah, not a big deal. We can totally work through that.
Okay, awesome sauce. Well, maybe we can sit down a little bit.
Oh, do you guys want to see our product room?
Oh, yes, please.
Yes, because as Audrey was saying, like, that is where it's starting with what you're doing at home. So as you can see, we have a beautiful product room.
I love skin.
We have a variety. Yes. So we have a variety of skincare lines, all medical grade. To your point, we do have the Face Reality line. Our estheticians are certified acne experts, so definitely can work with patients.
It's such a gentle line. I weirdly have never had acne, and then I turned 37 and my entire face freaked out, and I just had severe cystic acne, and Face Reality saved my face.
Yeah, I mean, it's a fantastic line of products.
Yeah. Incredibly easy to use and gentle, and I love it. Any products that you're like loving lately?
I'll say you can talk about like what your favorite is.
I love the Face Reality line off of you. I am an acne girly through and through, so that line has saved my life because again, it's gentle. It's not going to disrupt your skin barrier.
Yeah.
But also, I'm obsessed with plated.
Oh.
Yes.
Okay. I've never used them before. Tell us.
Okay, so it's exosomes. They actually did a study in the Mayo Clinic. So these are human-derived exosomes and growth factors, and you can use this prepping for a procedure, after a procedure, honestly, daily too.
Okay.
They market it as a skin treatment rather than a skin product because it is that good. So any brown spots, redness, it's overall great for just skin rejuvenation, helps with fine lines, kind of covers all your barriers, honestly.
Yeah.
And again, this guy is super, super gentle, so it's not gonna cause any irritations.
No, before and after treatments, am I using this daily as well?
Yes, you can use it daily. So before a treatment, it will really help get your skin prepped so that it will help your downtime be less, if that makes sense. And then after your treatments, it will just optimize things and accelerate.
Wow.
Okay, so they have a hair serum. What are they using?
We also have the hair and under eye serum as well.
Okay.
So the hair serum is for patients that are having some issues with hair loss or hair, like I was using it for, I had a baby, and if you've had kiddos, you know, sometimes you get those little like hair, those new hair growths here. So it's very effective at that. But it can be for men, women. It's good for all different types of hair issues.
Okay.
And then my favorite with the plated line, because it's also the plated line is my favorite, is the eye serum.
Okay.
It's super effective at treating crepey skin under the eyes, dark circles. So it's going to brighten up that under eye area. It can help minimize the appearance of like under eye bags.
Okay.
And help with the kind of those lateral canthus lines, the crow's feet that we get as well.
Okay.
One of my favorite things to collab with the PRP eye is going to be our PRP injectable treatment. So that treatment is done for under the under eyes for rejuvenation.
Yeah.
So those two combo is like amazing.
Yes. Okay.
Yeah.
Wow. That is amazing.
It's so cute in here.
Yes.
I
love
do
it.
like
It is one of my favorite rooms in the spa.
Yeah, it's very cute.
You're like, I'll take this, and this.
Seriously, absolutely.
It is hard when you work here not to literally own all of the
Try
products.
everything. Yes.
I love it.
All right, girls.
Okay, so now we're gonna sit down with you guys. The girls took us around. They showed us the most beautiful spa. We loved all the rooms. We got to go in the machine that froze us to death.
Cryo.
It's so cool. Live. So I think Ammari, we want to know like how did ARYA start, right?
Yes.
Are we saying that correctly?
Yes, ARYA.
Okay.
Yeah.
So in 2015, my husband and I, he's an ENT physician, and we decided to start doing injections on this other part of the ENT clinic. So we started doing, I felt like there was a need in this area for another injector, so we opened up, and then gradually ARYA has expanded. We added cool sculpting, and then we added an estheticians, we added facials, and then gradually over the last 10 years, we've been able to become a full medical spa with, you saw all the different machines we have and services we offer, so we've kind of grown into a full service spa.
Yeah.
It's beautiful.
It feels so
Thank you.
thoughtful here as well. You can tell there's a lot of intention in serving your clients.
And very educated. Like it didn't matter what questions. They like really made us feel comfortable asking questions.
very cool.
Yes.
Yeah, I do think that's one thing that we do pride ourselves on is providing that education. I think that goes a long way with your patient consultations, knowing what to expect before, during, and after. And we always like make sure they have a contact, whether it's our email, our office, or us directly sometimes even, to make sure they feel supported throughout their
Yes.
their journey.
Wonderful. You mentioned consultations. If I'm calling up, I've never been here before. What can I kind of expect? Maybe I'm a little nervous.
Yeah, I think that the majority of people are nervous, especially if you're a first-time client, never done this before. Social media, you can see some things that maybe just don't really portray the industry in the right way. So you would start speaking with someone from our front desk, and they will kind of guide you through a series of questions to determine what's the best option for you. We offer just consultations. They are free consultations. So it could be an injectable one, it could be a laser consult, Beautiful. Almost we have a consult specific for every service, and it's always complimentary. We don't want you to ever feel pressured to book that service.
That is a big thing. Like you don't want to be like oversold. Like even like that machine that I saw with your face, and like, you know, like obviously I know I need stuff, but I don't want to be like pushed down my face.
Right.
It's kind of like
and again, it's a little scary. So
and the VISIA is great because it really validates what treatment you do, right? So if you do a laser and you do the VISIA before and then you do it after, it actually validates that the treatment was
I
successful.
just did a laser on someone, and after one laser, it took her skin age down 8 years, and she's like, sign me up for the second one.
Yeah, she's probably still
she was ready for it. So that VISIA does go a very long way in supporting the client, right? And your investment and everything that goes along with it. So, but yeah, we'll have a free consultation. We'll sit down with whatever provider might be providing that service. All of us do a little bit of something different here, so that also I think makes us a little special too. So you're not just always seeing the same person over and over again.
Yeah.
But we do sit down with them. I specifically just ask them, like, what brought you here? Tell me more about it. Like, what's your skin concern? What bothers you the most? And then from there, we kind of dive deeper into like, what services do we have? Because as you guys saw, we offer a ton, and it can be overwhelming. Like, and if you've never heard of anything, like, do I need Sculptra? Do I need a CO2? Do I need BBL? Do I just want to start with Botox? Like, we are just not sure. So we sit down and we kind of go through that whole what service would be best for them, and then we kind of break it down to budget, and then not just working with that one. Like, I think you should probably start with the CO2. Let's clear the canvas, let's get you started, and then maybe we can come with filler later and tweak it a little bit, or now we can add some Botox in, and then it really just helps that patient see the longevity of the treatment plan, because you're not just treating them one day. We hope to keep you for lifetime.
Yeah, it's a fully customized plan to them.
And I bet you do keep them, because once you're comfortable, you don't leave.
Yeah, it's a trust issue, and like that's what your big consultation is really you're just building that relationship with that client. I'm not really trying to sell a product at that point. I just want to get to know you and how can I help you?
We pride ourselves on keeping you as natural as possible. We don't want you to look unnatural, and you know, so that's the big thing.
Yeah, there you go.
Let's start slow. I always say it's not a sprint. We're not trying to get there overnight. And it's truly not. That's not how it works. So
in that same vein, how do you kind of help a client manage expectations? Maybe a procedure is not right for them, or you're breaking down common misconceptions that they've heard, you know, on the internet or
I think that just goes back to education, right? Again, we do a lot of priding ourselves on educating the client. If they're picking a service that may not be the best option for them, then we just try to, again, educate of like why we would choose this one first over this one. And like maybe we could get to that later, but we need to start here first. Because patients do have expectations. It is, you know, the industry is only increasing in cost-wise. And so we want to set those expectations up front and again make it as budget friendly as possible for that person.
And we have a lot of before and after of our own clients, so a lot of times we can show them, you know, like this was this patient, you know, she has similar concerns, this was her journey. And even the CO2, you know, there's kind of a misconception that they think that they can put makeup on and go out the next day. And so we've shown them actual pictures, like no, day 1 through day 4, you're not gonna want to go anywhere or be seen by anyone. So I think giving
I was
them
just doing a
those
consultation on that this
expectations.
morning, and I was like, she's like, can I go to work tomorrow or like the next day? And I was like, you sure can. I'm like, no one's telling you can't do that.
You just might not want to.
I'm like, it's really up to like how you feel about it. I'm like, there's no way like, it's not against it. You're just, you're gonna be a little red and swollen.
I thought that was one of the most refreshing things. I was walking around and I saw the stat on the wall, and I was like, wow, look at this transformation. And it really gave me a sense of it's not selling a product. Like they believe in their services.
And I think we truly do. I don't think there's any service that no one in our office could not get behind, because you truly see results from everything that we offer. And it's not necessarily a one and done. Again, we talked as a journey. So again, setting those expectations for patients that like, I can get you here, but it's not going to be one laser. Like we got a little, you know, baby step our way into that result. So yeah, I think we stand highly behind all of our devices that we offer here.
I love that. Is there a certain treatment or procedure that you guys offer here that you're really excited about, or that you?
My favorite is the CO2, the helix. I do love that. I love because it's 3 lasers built into one. So you can really get an outcome with one treatment that patients are satisfied with. I, again, never say it's a one and done. You likely need 2. But again, it's something you can stair step into. I also do love a good transformation from your BBL Moxies as well, because those are quick, minimal downtime. And again, we took 8 years off someone's skin age by just doing doing that, getting that, clearing the canvas. You're just getting the pigment off, and then your skin is glowing and beautiful and looks youthful. And again, 4 days downtime, like we can do that, you know?
Yeah, absolutely.
I like them all. I did the helix actually last week, the CO2. And I'm almost 60, and it was my first one to do, and I loved that. So, but I also like the injections. I like Dysport, I like Sculptra, and then who doesn't like the facial? So
facials are great. They're a bit, I do love a facial and a dermaplane. We all need those. But I would agree. I think Sculptra is also one of my favorites. Because it's very natural. You know, it's not an overnight result. It's something that you do have to prep your clients for. Like, this isn't going to be instant gratification. But it is beautiful in the long run. I had a client that comes from Matt Toon actually, and we did all of our Sculptra, and then she was like, came back, she's like, I don't know if I'm like really seeing a change. And we did her before and after, and we all like almost fell over dead. We're like, it is huge. It's huge, a difference. Because you see yourself every day.
That's impressive.
And you see the slow, you know, as it's slowly working, you know, but when you actually see the very first picture before and
which is why they're so crucial.
So we usually always like to ask, like, what would you tell your previous self, like, 5 years ago? But I more want to know where, just because, like, where do you see yourself growing? Like, do you guys have other big goals coming here?
We do. We have a few services that we're going to add. We are adding massage in June or July. So we're adding that. We don't currently have that. We have a couple other ones. We're just kind of like, we're actually going to Las Vegas to a conference here next week. So we're hoping to find something new that we might like. So
our goal every year is to add something.
Whether
it be something small or bigger. Like last year, we already had CO2, but we went to Vegas and we ended up with a new skin tightening device and the helix, the CO2.
Wow.
Because technology is always changing, and the helix was tenfold. As far as comfort and results, and downtime for our clients compared to our old one. So it was worth making that transition. So we're always trying to stay up to date.
You have to, right?
Yes. This industry is changing day by day. Like there'll be something new out tomorrow. You know, like it's just crazy. So it is important to stay up to date on all that as well.
Wonderful.
Well, thanks for letting us come to your beautiful place. Ammari, do you have anything else?
Thank you.
Thank you.
Wonderful. We appreciate it. And okay, so if you guys are going to book, they can go to ARYA.com. And fill out your consultation forms. Guys, we are just like beyond. We had a great time. It's lovely.
Thank you so much for coming in.
Subscribe, share, and we'll catch you on the next one.
Thanks.
Thank you. You're welcome.